Okay, yes. So my name is Michael Walker. I'm a research economist at UC Berkeley. My areas of interest are in development economics, health, and public finance. And so this was a very exciting set of papers to be able to review and comment on. So thank you to the organizers for the opportunity to do so, and thank you to the authors for putting together some really interesting work. So the kind of commenting on the first paper, looking at health investment responses to expected retirement wealth in Chile, as was discussed, this is using a reform in the Chilean pension system to look at the effect of future wealth on current health decisions. I thought this was a really interesting way to kind of think about using this reform. And so I know that there's been a lot of work kind of around this reform. But I had, again, I haven't really seen anything like this either for this reform or for others. And so I really kind of applaud the creativity to be able to kind of think about this and think about how this may be affecting health. So again, this reform generates a kink, which allows for using a fuzzy regression discontinuity. They include a lot of the standard checks in the paper, and kind of from looking through it, it looks like things are working pretty well for a lot of those. And they find an increase in expected pension wealth results in greater use of screening tests, reduced prevalent rates of chronic disease despite greater diagnoses, and improved longevity. And I think this type of work also shows the value of these HRS type data sets where we're kind of combining health information with economic information and retirement information. And I think this is a cool opportunity where the authors really had to put that together themselves by kind of using some of these linked data sets to combine all this together, but still kind of providing an opportunity to kind of generate some of these insights. So since we're a relatively small group, I'll try to keep my comments, the rest of my comments relatively brief. But I wanted to kind of highlight one figure that wasn't shown in the presentation. And so this was looking, again, looking at these mortality estimates by cause, instead of showing them just overall by looking at a number of these different causes that they have in their data. And so I found it kind of interesting, but also just a little bit puzzling that kind of across the board, the partially exposed individuals have a higher predicted mortality risk, even from younger ages. And so it looks like this, from looking at this, this holds across a number of different diseases. In the paper, they also show that they don't really see changes in smoking or drinking. And so I guess, yeah, I was kind of just wondering, especially as you get into older ages, like the mechanism to me felt a little bit clearer. It's like, okay, they're going and they're doing these screenings, you're thinking about this future wealth, but is this kind of something else that's going on here? Or is there kind of like a cause for us to be a little bit concerned by the fact that even kind of from these younger ages, we're seeing these estimated level differences as we're going forward? And so this was making me wonder in kind of in terms of thinking about like, are there any other data sources that we could have to offer some more insights into what was kind of going on for some of these individuals from their time in the 1980s to the early 2000s, where we're really starting to pick up on some of this behavior. But I think this was a really interesting research question and a research design. And I also really liked the way that the authors kind of looked at the detection rates for a lot of these different diseases and combine that with the mortality risk. Because I think if you weren't careful about that, you could really easily see a case where someone's saying, oh, well, look, all these individuals have more wealth, but, we're detecting higher rates of a lot of these diseases, but they're kind of doing the work on the extra step to try to make sure that we're kind of interpreting that properly as we go forward. But I was just, I think anything that they can do to kind of shed a little bit more light onto some of these other mechanisms, especially in like the kind of the earlier life phases, would be really helpful in terms of interpreting the results and thinking through some of the policy implications that they may have from there. And so for the last paper, again, this was looking at mortality risk and health-seeking behavior during an epidemic, taking advantage of this intervention that was looking at improving mortality perceptions and how this matters for later COVID vaccine take-up for themselves and their siblings. And this was a really striking result. I think this for me was like one of those like, oh, this is like what exactly we want to see from a research side. It's like if again, as an economist, if you improve people's information and all of a sudden they start behaving better and kind of making decisions that seem more rational. So it was very exciting to kind of see this. And more than that, it's also we're kind of seeing some of these spillover effects onto families for siblings and things like that. So I think that it was just a really fascinating environment. And also something that really demonstrates like the benefit of the like looking longer term and conducting some of these like longer term longitudinal studies. Because I think that I could very easily see like this, you have the shorter term paper, you have that already, that's written up, that's published, you don't go back and collect any more information, you would never sort of see some of these additional effects that may be happening from this and really illustrating that, hey, this is not just a one-time thing, but this is leading to some lasting changes, which are really important. And so I think again, this was kind of covered a little bit, but I thought the healthcare utilization as a pathway was really interesting as well, and seeing this kind of substitution between some of the use of more formal health clinics as well as the use of traditional healers. One question just in terms of thinking about interpretation though, for this, and didn't know if I should be thinking about the COVID vaccination increase as a byproduct of additional healthcare access, or if the healthcare access was a byproduct of wanting to sort of get your COVID vaccine. And so, again, it doesn't change the validity of the results or anything like that. It just kind of affects the interpretation of what we think about the policy implications from this. So I don't know if there's anything else in the survey data that you have that would kind of show were people really explicitly going out to seek a COVID-19 vaccine, or was it just that they happen to be going to more preventive health clinics, and while they're there, the doctor is like, okay, yeah, I'm going to give you this shot as well, and they said yes to that. I think that there's scope for just a little bit more information around the study context as well. I know what was the information environment around COVID-19 and the COVID-19 vaccine in these communities. I know in many East African and kind of Southern African countries, this was a bit like highly heterogeneous depending on exactly where you were. And so having a little bit more context about that would have been helpful in terms of interpreting some of these results. Uh, Two, understanding again, general vaccination attitudes in this area. I guess I think again, a lot of these are kind of pushing in the direction of like, okay, can we generalize this for policy for other situations? Is this the type of thing that is like, okay, was this really a unique experience for this one area, or are there things that we could do to kind of like replicate this more broadly? And I think related to that as well was just again, there's been multiple rounds of the Malawi surveys, like that means that maybe there's some kind of trust already built into the with respondents for the enumerators or the study team or things like that. But kind of just describing that would help give us a sense for whether or not there's a lot that would need, or if we were going to take this somewhere else, how exactly would we do that? I think there's also scope for a few additional extensions that I'd be really excited to kind of see and learn more about. One would just be heterogeneous effects around gender, age, or COVID-19 risk that may be available in the data. I know this survey has also been collecting cognition data, and I think that would be another way to sort of think about like, okay, like, is this something that really those that are more high functioning on the cognitive side are the ones that are really able to internalize this, or is this kind of something that is benefiting everyone across the board? Since this study has also been collecting like information on social networks, this also sort of seems, again, there's many different types of papers and models that have looked at social learning or adoption of new technologies and things like that. And it feels like there may be a way to kind of either as part of this or paper as part of separate work to really think through that in more detail and whether or not you can think about how network centrality might matter for, again, this type of information flow throughout the community in some of these environments. So yeah, that's what I had for today. I'm looking forward to discussing more in the discussion.